What is causing your neck pain? Having neck pain can literally be a pain in the neck, but it can also lead to headaches and difficulty thinking, focusing, and being the person that you want to be in this world. It can be more difficult when you don't know exactly what is causing this pain in the first place. So today we're going to be discussing the different structures in your neck that could be causing pain, how they'll present, or what kind of symptoms you'll have with them, and what you can do about it. Let's go, PT. The first thing we're going to discuss is arthritis. Now, it's very important to understand that if you're over the age of 20, you probably do have some neck arthritis. That's just because gravity's been pushing down on your head for a long period of time. And if you're older, then it's even longer, and it can cause arthritis over time. The majority of the population does have arthritis in their neck, but it doesn't mean that it's painful. So if you've had some imaging done, an X-ray or an MRI, and they say you have arthritis in your neck, that doesn't necessarily mean that's what's causing your pain, but it could be. So it's important to consider your symptoms in light with everything else, including your X-ray or MRI reports. So arthritis symptoms typically will come through as a grinding sensation. It may sound kind of crunchy in your neck. You may feel like there's sand in there. That's a lot of times people describe it to me as there's sand in there or there's gravel in there, and it just feels like it's not a smooth motion. This will often lead to a dull, achy pain over time. And people will say, you know, it's just, it gets harder to move my neck. It's stiff, especially in the morning. Now, other than gravity pushing down on our head, what are other things that can increase your arthritis? Your risk for arthritis is increased if you have increased muscle tension, because that puts more pressure on the joints. And when there's pressure on the joints pushing down, it makes it difficult for them to get the nutrition that they need. And they will start to lay down bone, that's what arthritis is. The other thing we see particularly with neck pain is when people have poor posture. So if you're sitting with your head forward, that causes the muscle tension to increase in order to keep your head on top of your shoulders. And over time, that can cause arthritis symptoms. So if you've been diagnosed with arthritis in your neck, what can you do? Can you fix it? Well, there's nothing that we can do to get rid of the arthritis we currently have. However, there are things you can do, including decreasing your muscle tension, improving your posture, as well as just getting general cardiovascular activity to decrease stress and tension. All of this will help to decrease your risk of future arthritis formation. All right, the next one we're going to discuss is disc degeneration. Now, the vertebrae are the bones that link together to make the spinal column, and the discs are the shock absorbers in between them. When they start to degenerate, they can start to bulge out or kind of form a pocket off to the side, which can put pressure on the nerves or increase the irritation in the local area. If the discal material actually escapes the outside of the disc, that's called a disc herniation. And what will happen is that the discal material will be outside of the disc, which means it has to be reabsorbed by the body. But until it is reabsorbed by the body, it can cause a lot of irritation because those nerve roots are right there. So if you started having an onset of numbness and tingling in your hands or your forearm or down your arm, it could be that that disc has either bulged and put pressure on the nerve, or has actually herniated and is bathing that nerve in an irritant that's really causing you pain and dysfunction into your hand and arm. Now, most commonly when people have either a disc degeneration or a disc herniation, what they'll describe is a sense of instability. So it's difficult to keep their head on top of their body, or they feel a lack of mobility because that disc is kind of getting wedged. So they'll feel like, I can't move it any further here. Now, the thing to remember is that any motion that's painful is contraindicated. So I do not want you to be going into painful motions and saying, oh yeah, this is like, it's limited, I can stretch it out or something like that. If there's a disc or even a joint problem, you're not going to be able to move past that necessarily. So we want to avoid painful motions to make sure that we're not irritating other structures during that time. Discs will heal on their own, and the primary thing that they like is rotation. So that would be sitting up nice and tall with your head on top of your shoulders. You would turn to one side as far as you can, and then to the other side as far as you can. Now remember, if this motion is painful, we want you to stay in the pain-free range of motion, because if you go into the painful range of motion, that causes the muscles to contract. If the muscles contract, that causes compression. If that causes compression, it puts more stress on the disc, which is what started this problem in the first place. But the discs do like rotation, so as much as you can tolerate movement-wise, make sure you're doing it regularly throughout the day. You may even find that your motion increases as you do more of it. Now, one of the primary things that I see in the clinic that causes neck pain is muscle strain or muscle spasm. And I think that this is for two reasons. One, obviously the arthritis can lead to this. Two, obviously the disc can lead to this. But three, many people carry their stress up in their neck and shoulders. In addition to that fact, if you are not breathing properly and doing that nice diaphragmatic breathing, you will be forced to use the accessory muscles of respiration. Now, those muscles are found up in here, in your neck. So if you're not using your diaphragm, you are going to be using these muscles up in here. They're not supposed to be used for breathing, except in fight or flight circumstances. Now, I understand that in today's society, we tend to live in a fight or flight state, but that doesn't mean it's healthy for our neck and shoulders. Being in this state will cause us to use these muscles of respiration for breathing, which causes increased muscle tension, which can lead to other issues, including that disc degeneration and even arthritis. So the symptoms you'll often have with this is feeling like you want to stretch all the time. You'll feel like the muscles are tight, just like any other muscle, and I just want to stretch it out. And if I could just stretch it out, it would feel much better. The problem is there's no way to stretch it out. If you continue to use those muscles abnormally, they're just going to tighten again. If you're suffering with muscle strain or pain, then I definitely have some great tips that are going to help you. First thing, we've already discussed, you want to make sure you do your deep breathing. We've got to make sure we're using that diaphragm muscle to do that breathing, which will take some stress off of those muscles up in here. Also, diaphragmatic breathing activates the vagus nerve, which decreases our fight or flight response. So you'll get the benefit of a decreased fight or flight response, activation of the vagus nerve, as well as decreased tone in the muscles in your neck and shoulders. Now, no matter what is causing your neck pain, I highly recommend you avoid sitting for long periods of time, especially if you're not able to sit in a good position. Now, often we talk about that good position, especially when you're at the computer, right? You want to be having head on top of shoulders, shoulders on top of hips, and making sure you have that normal curvature in your low back. However, this can be difficult to do if you're in different positions, such as on the couch or in your car, or even just sitting in a different spot for a prolonged period of time. So you want to make sure that you're in as good a posture as you can be. You want to ensure that your back is well supported when you're sitting so that you're not having too much stress and you don't have to overwork the muscles of the neck and shoulders. Tip number 3. No matter what is causing your neck pain, you want to use some ice. Now, I know a lot of people say, I don't want to use ice for my neck. It bothers me. I feel like it's going to increase my muscle tension. I don't feel good being cold. You only have to do it for 3 to 5 minutes. That's what the research indicates is the most helpful for pain inhibition or decreasing your pain. And if it really bothers you to have ice on your neck, I totally get it. You can either curl up in a blanket, sit in front of a warm fire, or even put a hot pack on your core, so near your organs, to make yourself feel warm so that the ice doesn't bother you as much. And tip number 4 for dealing with neck pain, I highly recommend getting some cardiovascular exercise. So getting your body moving, getting the blood pumping will help to significantly decrease your pain and also cause you to do some deep breathing, which again activates the vagus nerve and decreases tension in your neck and shoulders. Now choose whatever form of cardiovascular exercise you enjoy. It could be walking, it could be running, it could be swimming, it could be elliptical, it could be spinning or biking. Make sure it's something that you enjoy doing, because that will help to decrease your stress, which will also help to decrease the tone in your neck and shoulders. Now, what's your favorite way of dealing with your neck pain? Did I mention it here? If not, definitely drop a comment below and let us know. Let's have a community that supports each other and gives each other ideas. And if you don't know how to do that deep breathing, then I recommend you check out this video here. If you'd like to understand more about your neck and shoulder tension and how it's connected to the rest of your body, I recommend you check out my book, Movement is Life. Have a great day, everyone.